Hello, my name is Dr. Alan Lumsden. I'm the Medical Director here at the Houston Methodist DeBakey Heart and Vascular Center. And welcome to the DeBakey CV Live Studios. One of the series of topics which we've been covering is around innovation. Now, innovation is an oft-used word, but I'm delighted today to be able to welcome Michel Therin. He's the president of Siemens Advanced Therapies, and innovation seems to be in his blood. And he's an example of someone who has been an innovator all his life and has now ascended up to lead one of the most ingenious and innovative divisions basically in Siemens. I want to start off before introducing you a little bit more to Michel with a quote which I found. This was when he joined Siemens Healthineers, because as you'll see, it's not an obvious fit. And so when he joined, he said, "Siemens Healthineers is here to help make medicine more precise, more effective, and more affordable." I, Michel, share the same and look forward to helping healthcare providers create personalized therapy and use imaging and diagnostics to precisely guide minimally invasive therapy. And my common belief for them is it's all about finding the right treatment for the right patient at the right time. So we're going to explore today these topics of how a man who started off as a vet moved through his career and now leads Siemens Advanced Therapies. So welcome to the DeBakey CV Live Studios. Michel, I know you're joining us from Lyon today. Thank you for taking the time to join us.
Thank you very much for having me. It's a pleasure. I wish I could have been live with you in your studio, but I hope that we can enjoy the conversation anyway.
I think we will, and I think we'll enjoy personal conversations very much in the future. So let's go back to the beginning. I learned a lot. I've known you for some time, but I learned a lot about preparing for this. And so you started off life as a vet. So tell us a little bit how you moved from being a vet. We traditionally think of vets going into taking care of animals, you know, in practice. Tell us a little bit about how you evolved from this early phase in your career.
Yeah, you know, taking care of animals is often a dream of a kid. So I pursued that dream up to the end of my studies. And at the end of my studies, I was probably looking for a purpose or how to find my way. And I can tell you a quick true story. I was finishing an internship in a pretty large vet hospital in Paris. And one of the vet over there was pretty famous because he had developed a unique technique of surgery called a ureterostomy in cats in order to facilitate the evacuation of lithiasis in male. And he was very well known in the field, and I was acknowledging him and said, "You should be proud. You are arriving at the end of your career, and you have strongly contributed to the veterinary medicine field." And I say, "Congratulations for that." And he looked at me with a little bit of nostalgic smile and mentioned, "You're right. Thanks to my contribution, 500 cats have urinated normally up to the end of their life." And at that time, I realized, I don't want to arrive at that conclusion in 30 years from now. And I decided to try to catch up on the human side of healthcare. And that's when I started to look what I could do. And I met orthopedic surgeon in Paris also. And at that time, it was the field of orthopedic biomaterials was very active. There was a lot of work in artificial ligament, in new coating, bone induction type of technology. And he was looking for developing advanced animal models. So he was looking for an experimental surgeon. And I said, well, that's very interesting. I want to be part of that project, but I do not want to stay uniquely as an experimental surgeon. I want to learn the entire space, the material science side, the pathology side. And that's when I started again a master in biomedical engineering and then a PhD in biomaterials. And finally, a degree in pathology in order to have the full spectrum of evaluation technique for developing new technology in that space.
And so at the conclusion of your PhD at that point, you moved on to a company called Biomattack. Tell us a little bit about what you learned there and what attracted you to Biomattack.
Yeah, correct. Initially, I thought I could continue in the academic field, but at that time, biomedical engineering was a little bit in between life science and engineering science. And my home country is very, I would say, conservative in the way they consider research. So that was not a field where you can really drive your career. So I've been requested to join a company called Biomedtech NAMSA in order to take care of the biological evaluation of medical devices in development. And it was a fantastic observation point because I was able to do, of course, in orthopedy, which was my originating field, but also in vascular, in urology, in dentistry, even in ophthalmology. And I was touching a lot of different technologies that were in development in those fields. And so I stayed there for a few years. And then one of the startups that I was working for was looking to change their trajectory, and they were leveraging through a LBO new funding in order to speed up the development of their technology. And I joined them at that time, became one of the shareholders of that startup, and developed that startup from scratch, their entire pipeline of product, and taking care about the development of the operation there.
And so how did you end up at Florian?
So Florian is that startup.
Oh, so, that is the startup.
Which was a young company developing implants for hernia repair. So I spent quite some time developing technology for helping minimally invasive surgery in that space. And I was fascinated by the opportunity that laparoscopic surgery could provide to that space. It's not a field that is well known by many in the healthcare domain, but especially incisional hernia can be very devastating, and they are not easy to treat. It sounds superficial, maybe not as noble as other surgery, but managing those kind of big defects is a challenge surgically, and it has terrible potential complication associated in terms of infection rate, in terms of pain, in terms of rehabilitation. And this is a space where minimally invasive surgery could improve a lot the outcome. But there was no implants, there was no reinforcement material compatible with that use. And that company, I developed a full spectrum of technology in order to facilitate, enable the cure of hernias, all type of hernias, through minimally invasive surgery.
Yeah, I looked through your patent list, and when I got on to page 5, there were so many variants of delivery systems, biomaterials, plugs that you were creating. You're clearly immersed in the hernia field at that point in time. Why'd you leave?
That's right. Yeah, that's right. And it was a space which was, again, relatively virgin of any dedicated technology adapted for minimally invasive surgery. And I remember one story. I spent a lot of time at that time. It was a small company, so I had a little bit more time to do that. I was visiting a lot of surgical departments, spending time in the OR, discussing with surgeons, and more importantly, watching them, observing them in their daily practice. And one time, a patient was opened from the sternum to the pubis on the table for 4 hours, with all his abdominal muscle dissected. And I said, well, would that not be more easy to go in a laparoscopic approach and patch it from inside? And the surgeons told me at that time, well, we would love to do that, but there is no implant that could and combine fast tissue ingrowth to the abdominal wall for an effective biomechanical repair, but at the same time prevent severe adhesion of the bowel to the material. Mm-hmm. And I said, well, that's maybe something that I can help to solve. And that was one of my first patents, and a product that was combining 2 technologies, 1 implant, an anti-adhesion layer, resorbable hydrogel on one side, and a porous material on the other side. And that patent has been, that product issued from that patent has been very successful, and has absolutely accelerated the growth trajectory of that startup, and to become, and it's still one of the standard of care now, 20 years after. So that was a field where you could be very creative. And if you were on the front line and really observing what was happening, if in the meantime you could understand what the technology can bring to the field, it was not that complicated to find interesting ideas.
You know, I think that's one of the important messages. You were almost in the right field at the right time. Although you say it doesn't seem very noble at the moment, it's because people like you have done such a good job in making it normal that this is how these are repaired. But at that time, I guess Guidant were the ones who, I know many of the people who are involved in the Guidant research programs in the United States, and they've gone on, a lot of them are in the cardiovascular space, to do very great things. So I think what was happening at that time was the focus of minimally invasive delivery systems was around hernia. And that attracted people like you to work in it because you could be creative in that space.
Correct. And another aspect, two things that I would like to add on that is that at that time we were almost agnostic of the technological solution. We were really specialized watching and trying to resolve issue in the OR. So I had gathered technology coming from different fields because that was making sense in answering a need. And so that's one aspect. Don't be too much close to one single technology. Remain open for combining those. A lot of innovation are coming from combining the right technology at the right time for a given purpose. That's point number one. And point number two is observe, watch. It's in MBAs or marketing courses, you often heard the term voice of customer, VOC. It's a standard in marketing courses. It's nice to talk and to collect feedback, but it's also very important to observe and to watch, because sometimes people are not articulating really the full picture of what they are facing. For example, the example of that big incisional hernia, when I was talking to the surgeon at that time, they were more looking for something that could help them to manage the hemostasis, to get access with instrument to area which were tiny and very deep in the muscular layers, stuff like that. I mean, they could not project that the technology could allow now to develop an implant to do something that was not known before. And that is our role as Innovator, is to really bring that added value to the space.
Well, those are tremendous points. Sometimes we can't even conceive of what that solution could be. But I think as a surgeon, I think what you're saying, we have the ability to destroy technology if it's too difficult for us to use. It's not only has it got to be a good technology, it's got to be something that we can, it's not so complicated that our nurses have trouble loading it into a system, the surgeons have trouble delivering it. And so understanding from the concept of the product all the way through to how this is going to be delivered is, I think, the lesson that you learned in that. Okay, so let's go on now to, all of a sudden, Covidien appears in your life.
Yeah, a couple of those products started to be registered in the US, and I had developed a subsidiary over there to distribute the product in the US, and we started to get traction in the market. And the big players, which were all American, watched that small French company as a unicorn a little bit, which was starting to appear. And rapidly we got into contact with some of them. And initially I was feeling that I did not need really the help of a large organization, but in fact, I was spending more and more time on the distribution channel. So building the go-to-market structure in order to reach the customer where they were. And for a small company, it's a huge challenge. It's heavy time-consuming, it's heavy capital-consuming, and this is typically what a large organization can provide, the strength of their channel. So after a couple of years of those conversations, we accepted the proposal that Covidien was sharing with us, and we became a new small entity within the Covidien world. That was a big transformation because at that time we were 150 people, I think. And suddenly you are part of an organization which is, I think Covidien at that time was 30,000 or 40,000 people. So it's a huge cultural transformation. But that was an interesting one to live. I learned a lot.
Yeah, I'm sure there were some bitter lessons in that process as well as some real learning moments. Okay, now, was it when you were with Covidien that you started working in Strasbourg in the European Institute for Telesurgery?
Yeah, so I knew the team in Strasbourg because they are very famous in France. So I knew them from my previous small company. But when I joined Covidien was one of their strategic partners. All the big portion of the training that was delivered to general surgeons was going through Strasbourg, at least for the European part. And so it was a natural continuity for moving from that small company to the large one and change a little bit the status of my collaboration with them. Before I was using them more as a research partner, but at a relatively low scale. And suddenly I became one of their strategic partners for education overhaul for all general surgery purposes. So yeah, Strasbourg is a very good example, and it has a lot of similarities with what you have built in Houston, where you can combine large strategic scheme partnership, which combine research as well as education. And as you know, education is a critical component. You have to make sure that there is a safe and effective use of the technology that you are developing. And it's always associated with a strong partnership with teaching institutes if you want to do things in the right way.
So let's come back to talking about education, because it's one of the topics I'd like to go into in a little bit more detail with you. Medtronic then came along and took over Covidien. Now you're part of the biggest medical device company on the planet. You went in a few years from being your own boss to working in Medtronic.
Yeah, to be honest, if you would have asked me that question 20 years ago, I would have probably said I would never survive in such a large organization. And initially, I was extremely committed to the team and to the site that I had developed from scratch. And I tested a little bit what it looked like to work in a large organization like that. And I enjoy it. And because you have a lot of very competent people around you, you have the scale in front of you. And then it's a teamwork. It's a very strong teamwork. And from Covidien to Medtronic, that has been even amplified. It's both great company to work with, and I enjoy my time over there. I mean, the same way Covidien took over the small company, they respect a lot the culture of that small company, and they let me continue to develop the technology, to develop the business. That was a business that was relatively new for them. They didn't have any implants, and Covidien didn't have almost any implants, apart from sutures, which is a big implant, an important one, but they didn't have anything else. And so that let me continue to develop that culture within Covidien. And then when Covidien has been acquired by Medtronic, that was a little bit the same story. Medtronic had no activity in general surgery. So Covidien became their general surgery branch, what they call a group. They changed the name. It's called now MITG, but with the exact same spirit. And with the ability to develop the technology and to really continue on the same direction, which is the promotion of minimally invasive therapy for lowering the burden of surgery and improving clinical outcomes.
And you were in charge of the general surgery component at Medtronic at that time.
That's right. So within the Covidien role, I have never left completely the hernia role, so I have always capitalized on it, but I have expanded my role, and the last role that I occupied within Medtronic was in charge of the general surgery component, and especially the upper GI side. I had colleagues who were taking care about colorectal cancer, but I was spending a lot of time on liver cancer, gastric cancer, pancreatic cancer, and so on.
And so one of the questions I'd like to ask you is, you come from a startup mentality where you're innovating, you have a group of people sit around, they talk about things, you got an idea, you make a consensus with 4 or 5 people, let's go try it in the lab. And then you move into this big company. Is it possible to maintain that kind of innovation, entrepreneurialism in a big company? Is there a way of firewalling that kind of innovation and continuing to have those ideas being generated?
Yeah, it's not easy every day, I should be honest. But because the verticalization of a lot of activities is not keeping you very close to the field. So I loved, and I continue to love, to spend time with you in a cath lab or in an OR, because I feel in my role, but it's not anymore really possible. So you have to develop the teams and the people in order to entertain that time of mindset. It's a question of mindset. What is nice is that you have now, especially with age, you are taking a lot of pleasure by developing people and developing expertise and developing motivation, and seeing a team behind you sharing your motivation in order to move the needle somewhere. And that's when you have that in mind. I'm always coming from the patient. Any teams that I have managed for the last 25 years, always, does that make sense for the patient? Do we improve some more things for him? And if we improve something for him, there is a very high likelihood that a lot of key stakeholders will also find benefit. You as physician, your administration as a care provider, and even the payer at the end might benefit from the innovation that you are developing. So everything is screened in that perspective.
Okay, so now we're going to get on to what you're doing now. Here we have a French guy who is a vet, who's been working in hernias and then general surgery, and all of a sudden Siemens comes along. Not exactly an obvious recruit at that point in time. Tell me how this happened.
And that's, to be honest, that has been my first question to the CEO of Siemens Healthineers when we met for the first time. Are you sure about your casting? I mean, I'm not an image. I'm not an image expert. And he's, Bernd Montag, tall, very serious guy, and he looked at me and said, "You know what? I have already more than 500 PhD in physics, all world expert in imaging. I don't need one more. So what I am expecting from you is really to bring that culture of what is the therapy world? How can we speak? How can we be closer to the language of the therapist, the physician who are really doing the treatment in a lab or in an OR or in a cath lab?" And we are coming, Siemens Healthineers, with a very strong background in radiology, in diagnostics, and their technology were used also for therapy application, but without a deep interaction or a deep clinical understanding or a deep clinical focus in the strategy that were deployed. And that basically was my roadmap. He said, we are preparing the IPO of Siemens Healthineers, which is a major step forward for the development of the organization. This is the time to set clear strategy in the medical field where we want to play. And we will we will take advanced therapy as one of the publicly reported domain of Siemens Healthineers. And this is that will become an important topic. Would you like to take care of that? And I said, wow, that's a huge opportunity for me. I was working in, as I said before, in the general surgery field, and I was more and more facing situation where I knew that the next level of improvement will come from image guidance. Yeah. And in Medtronic, that was not our core technology. And when Siemens contacted me, that was, I said, the timing is perfect. I mean, I would have dreamed to work in that space as well. And so I accepted very quickly. So it's not an easy move after many, many years, and very satisfied, by the way, with the experience in Covidien and Medtronic to accept such a huge change from an American organization to a European organization. Since then, I enjoy a lot what has been my journey in the last 2 years and a half almost.
Well, I think that shows very well. I come from the point of view of, I've always felt that there's a gap between the device companies and the imaging companies. And it always felt people like me and other users who are in the middle trying to say, you guys need to be talking to one another. And I think choosing somebody who comes from that world is brilliant, to be completely honest with you. I always say, I give a lot of talks on endovascular surgery and say, what's the first, second, and third rules of vascular surgery, endovascular surgery? Imaging, imaging, and imaging. And it is the ability to transform the entire. I look back and say, when I did a FemPop and we did a completion angiogram, in my lifetime, in my professional career, it was a flat plate x-ray underneath the patient, you injected dye, a radiology tech took it down to the radiology department and developed the film and came back, and half the time would say, sorry, we got the timing wrong, we got to do it again. And so the ability to have these portable C-arms were the enabling technology, at least in the surgical world, that gave us real-time imaging, which allowed us to get to really where we are at the moment. So you moved to Siemens, and one of your first big moves is to acquire our endovascular robotics company. And I'm sure that led to lots of interest and discussion internally. Share with us what you can and what your vision was from that standpoint.
Yeah, it was an interesting journey, and I'm very pleased to have been able to convince that organization to acquire such a bold technology. I had observed the emergence of robotic assistants in general surgery, and as initially 15 years ago, there was a lot of key opinion leaders who were not really convinced about what would be the benefit of robotic assistance. And we have seen the progression and the benefit it could provide. It's not only much more convenient and ergonomic, it's also much more precise, it's also much more reliable. It's helped to standardize the care delivery, and overall it's increased the precision of what you are doing. So basically a surgeon using the robot will tell you, I feel I'm doing a better job when I'm doing that procedures with the help of the robot. And I was seeing that, I have seen that come in the general surgery space, in the spine space, and with the endovascular, it's a little bit different, but you could see exactly the same kind of benefit. But the big difference is that the synergy with the imaging is much higher in the endovascular field than it is with the general surgery robot, for example. In the general surgery robot, you are dependent on an endoscope. The endoscope allows you to see what you need to see from the surface of the organ, but it does not guide you within the organs when you have to understand where are the critical components that you will face. In endovascular robotic, this is completely different. Not only you see what you need to see, but the imaging system can help you to guide and to go where you want to go. You go through the surface, you see through the surface by definition. So it makes a lot of power, a lot of guidance will come and should come from the imaging technology. And combining a robot and an imaging is combining the hands and the eyes of the physician and providing an assistance. It's empowering both in parallel. And you can imagine that you can develop a lot of application by combining the two. In the future, it's not today for sure, but in the future, it's likely that you can point somewhere and the robot will get there automatically guided by the imaging system. So that opened a lot of fields, and that's what was exciting us considering that approach. It's true in cardiovascular disease, it's true in neurovascular disease, and it will be probably true also in interventional oncology. So I think that was my storytelling to the board of Siemens to convince them that it was the right move to do for us.
Well, I love your analogy of, in fact, I'm going to use it. That's the ultimate compliment, is to use your words, combining the hands and the eyes of the interventionalists is a really, that you go right to the core of this. So we have a very strong relationship here at Methodist with Siemens. Tell me about what you perceive as the value in working with leading academic medical centers, and then segue that into how do we help with education?
Yeah, so it's absolutely essential. I mean, I could not imagine to do well my job and to achieve what our goals, to reach our goals without having strong partnership with leading institutes. And not only for developing a technology or validating the technology through clinical trials, which is usually what a lot are doing, but also in how you can disseminate the technology through advanced education institute as well. So, and there are very few institutes in the world that can combine all that in one site. And especially even more when you start to touch some variety of disciplines in the same site. And you were mentioning Strasbourg. Strasbourg is one example. Your institute is another example. And there are a few others in the world, but not that many. So we value a lot those partnerships. And they are here to continue to exist and to be reinforced. I'm pretty sure of that. More of what we are doing is more and more specific to a given procedures. And so more and more we will be in need for having the support of education institute like yours to make sure that the technology is correctly used. So,
well, Michel, it's
thank
always
you for being our partner.
We're glad to. It's a privilege, actually. It's 30 minutes goes by very rapidly when you have someone as engaging and interesting as you to talk about this. We may have to do this again to get the next phase of your career. Is there anything you'd like to mention in closing, and we'll let you go back to your real job?
Thank you. No, I think Image is there to continue to support the development of minimally invasive procedures. I think historically it was a lot about seeing. It will be more and more about guiding, now assisting. So the combination of the robot with the imaging system is really to assist. And I can see also real-time monitoring as a predictor of the value of the clinical outcome. So if you combine see, guide, assist, and monitor, you have probably the 4 pillars of our future, of our joint future.
All right. Well, thank you very much indeed.
For having me.
Thank you for spending time with us today. Always exciting to listen to somebody who sees over the horizon and sees what the next level of intervention and combining it with imaging is. Thank you very much indeed, Michel, for spending time and talking to us. Appreciate it.
Thank you very much.